Go.
Hello, my name is Sabina and I work for Denver Health Medical Plan. Today I have with me Chris, who is one of our nurse managers at Denver Health. Welcome, Chris.
Hello, thank you for having me.
So today we're going to be discussing the vaccine disparities. So Chris, we're just going to jump right into our first question. Why do so few Black Denver Health patients, the data shows only 24% get the flu shot?
Wow, I didn't realize that it was such a low percentage of a population that receives vaccines. But there may be several potential reasons why the African American community have lower flu shot utilization rates compared to other groups, such as historical mistrust of the healthcare system, misinformation, access barriers, healthcare provider influence, cultural perceptions, along with cost may be a factor, and distrust of the pharmaceutical companies along with the governmental agencies may be leading causes to why there's such vaccine hesitancy within this community.
Amazing. Thank you so much for that. We're going to move into our second question. Are there outside influences or cultural specific beliefs that potentially impact the trust around vaccines?
Yes, there are several. As I spoke in my previous answer, the main one being the historical mistrust of the healthcare systems due to the past unethical medical practices, such as the Tuskegee experiment, for instance. There's a lot of mistrust within the African American community towards healthcare systems.
How can healthcare institutions help Black patients understand the importance of flu shots and other vaccines while addressing mistrust?
To improve the flu shot utilization among African American patients, a multifaceted approach is needed, focusing on education, accessibility, and trust building.
At your clinic, who do you typically see coming in to get a flu shot, and who do you think need to be getting a flu shot?
At my clinic, we have a high vaccine rate, so the majority of the patients during flu season are receiving the flu shot, and that's who I think should be receiving the flu shot, the entire population, because the flu affects every population set from pediatric to geriatric. So all parties need to receive a flu shot.
Wonderful. So I have a fun question for you.
Yes.
So when someone comes to your clinic and they're afraid to get the flu shot, what do you usually tell them?
That's interesting. It depends on why the hesitancy with the vaccine. Is it because they're unfamiliar with the vaccine, or are they just afraid of needles? Because sometimes we get a lot of people who are fearful of getting shots and needles. So what I try to do is to calm them down and ensure them that it is a safe practice to receive a flu shot, and there will be many benefits from receiving the vaccine, and try to approach them in a playful manner so that they understand what's taking place.
So there's this myth out there that you can get sick from the flu vaccine, like you can actually get the flu from the flu vaccine. Could you please enlighten us, address that for us?
Yeah, that comes from misinformation that's put out there because it's not an actual live virus, so it's not introducing the flu vaccine to the patient. Most of the times when people have a reaction or get sick after the flu vaccine, they already had a cold or something building up in them prior to receiving the vaccine. But the flu vaccine itself is safe, and it's not a live virus, I guess I should state. So it's not introducing the flu vaccine to the patient.
So Chris, thank you so much for coming to talk to us today and addressing vaccine disparities.
Thank you for having me. I really appreciated my time here, and hopefully I gave some information that could be beneficial.
You did. And we would just like to thank our viewers as well. See you in the next one.